We will now transition to our next presentation. So care opinion as a data source for evaluation, the experience of the Prince of Wales Hospital. When we introduce care opinion, we often say that we are more than a data source, but it's important to recognise that qualitative feedback does have value as a data source, particularly where it can be collected, responded to, and or acted upon a real time. And I'm delighted to introduce a presentation from one of our longest serving care opinion Australian subscribers, the South East Sydney Local Health District. Presentation by Justin O'Hare, who's the Co-Director of Nursing and Operations at Emergency Specialist and Continuing Medicine at Prince of Wales Hospital. Joining Justin is Francis Nicolas. Francis is the Service Manager for the South East Sydney Local Health District Community Management Centre and the Virtual Health Platform for the Health District. Justin and Francis will share their experience of using care opinion as a means for engaging with consumers in the most challenging of times and evaluating service redesign through feedback stories at the Prince of Wales Community Management Centre. Thank you both and very welcome.
Thank you. Thanks everyone for having us here today. We'll just go to the next slide. Thank you. The next one after that. Just a bit of a background. So the Community Management Centre at Prince of Wales Hospital is currently now transitioned to be the virtual health hub for the district of South East Sydney Local Health District. But prior to that, if we're setting the scene in September 2021, during the Delta wave of COVID, the district, we needed to really set up a service to be able to, tend to the needs of our adults in the Cecily community that were with COVID-19 due to the hospital presentations and whatnot. So we upscaled a remote monitoring service within 2 weeks. And that was utilizing a smartphone app, which we had trialed through Total Cardiac Care earlier in that year, but that essentially monitored our patients for their pulse oximetry, temperature, and had a well-being questions with that. So we set that service up within 2 weeks. And this led us through the multiple ways of COVID, monitor our patients, particularly the high-risk vulnerable patients at home, allowing them to stay at home during the isolation in the various lengths of what that became, but then also navigating their care through the primary health network, their specialists and whatnot through the remote monitoring and through the CMC. So during the peak, we saw 12,000 patients come through, and then after that, this year we've transitioned into monitoring our heart failure patients at Prince of Wales, and like I said, it's now moved into being the virtual health hub for the district. So if we go to the next slide, as I said, due to the rapid need during the Delta wave, there was really a lack of co-design with the service, because we had to really set up on the go really within 2 weeks. But after 5 to 6 months, we looked at opportunities of how we could, engage some more feedback from patients. Also, when staff were contacting patients, we're getting informal feedback, which we would acknowledge, and that was through when we're doing daily calls and wellbeing checks. But we thought care opinion would be a great source to get feedback from. Part of our processes is everyone that was onboarded would get sent out in a courier that day a pulse oximeter. So we thought, why not put on the care opinion sticker to the hundreds of pulse oximeters we're sending a day. So if we go to the next slide, probably the one after that, you can see, so from May, it was really the end of March, we did it from May to September, where there was some peaks, those real peaks last year in 2022. You can really see we had, 5, 18, 11, 10 care opinions a month come in, where there was stages there during that winter part of the year where the co-director in my role at the time was having trouble keeping up with the meeting the KPIs for the responses to it. So we got a lot of good feedback from it. 99% of them were positive that come through. A vast majority from the patient themselves, but then also we got some throughout the from other clinicians as well. But we out of the positive feedback we got there, we also got some good suggestions and what we can do in regards to the service to tailor it to the patient, because there was being high risk patients, there's nuances in each type of patient that would come to us with the level of risk with the comorbidities that have. But we learned a lot from what we got from Care Opinion and how we modified our models of care as we've continued to go along. But it also helped us with shaping us moving into the heart failure space, and then also now moving into the virtual health hub for the whole district and moving on from there. So I'll pass on to Francis now, who will talk a bit more.
Next slide, please. Good afternoon, everybody. My name is Francis. I'm the acting service manager of the Community Management Center. So it's a district-wide service hosted by the Prince of Wales Hospital. I am now going to present to you 3 patient feedbacks. And this first feedback will talk about an immunocompromised high-risk patient who has been in a service for 2 weeks, and also highlighted that she is being cared for. And it's also highlighted that Care Opinion is transparent, convenient, and can provide real-time patient feedback. It's also measurable, and it gives us an accessible access to everyone, which also allows users and providers to connect. As you can see, we were able to respond on the patient's feedback on that end. And also on that feedback on the second real-time response is, it's actually a staff member who has been on our service and given a feedback to our service, because he felt that it was very touching, and it's very heartwarming, it's very personalized, and we were able to feedback that evaluation to the staff itself and also to our managers. So next slide, please. Up. So going back again, would you be able to go back on the next slide before that? So this feedback is also an example as well of a high-risk patient, which actually on our service, but on a different hospital, but on the same local health district, with actually given a good feedback. But also, if you can scan it through the first 2 or 3 sentences, it's actually the patient has given a feedback that there's a lot of processes happening on the time, because the patient went to ED, went to talking a lot of different people, but it also serves us to as a linkage to different local health district to communicate the care that we provide and the feedback that we needed to know as a health service in general. So this shows that Care Opinion benefits the Southeastern Local District in terms of getting the patient's experience. So next.
And if I just step in on that one
Yeah.
there, I think the key to that is at the community management center was ideally a nurse-run service, so we didn't have a specialist actually in the service. So we utilize that type of feedback to be able to link patients with their specialists, their GPs, their treating clinicians, and things like that, to prevent hospital admissions and make it more linked outside in the community. And we actually had a 3% ED presentation rate for COVID since we've been operational. So I'll let Francis keep going.
Yeah. Thank you, Justin. So looking at this, I believe that in our service believe here at CMC that Care Opinion empowers. It says in here 55 stories has been told, but we're not focusing on the numbers, but we're focusing on the moments that we have experienced with the patients. And we are able to continue that until today as the newly established remote patient monitoring service in our local district. So that is one of our patients for our remote monitoring um, team. So next slide, please. So I also wanted to highlight that Care Opinion cares not only for the patient itself, because I know Care Opinion talks about patients, but here at CMC, I managed to collect all the Care Opinion Hero Certificate Awards from the time that we started, and I individually delivered that to each and every staff that has been mentioned to Care Opinion. This serves as a boost of staff morale, and also during the urgency of and the busy times of COVID-19, I think the best thing that we could do is to recognize the staff members, the times that they're spent with a patient, being a ultimate support during COVID, and not only during COVID, only that phone call that really supports patients at home, and they felt that they're being cared for. This also increases the workforce engagement regarding the staff. And I think Dr. Annie had mentioned a while ago about compassionate leadership. So this is, I think, compassionate leadership that we should echo within our staff members. So yes. And as part of Care Opinion, I have asked a few members of our team here at Care Opinion at Community Management Center, what do they think about Care Opinion? So these are the few feedbacks that they have given me. So I'll give you a few seconds to look at it. And I do believe that Care Opinion and also um, triggers or supports the well-being of the staff members, because I do think it works hand in hand. Care Opinion empowers, and also not only empowers the patients but also empowers the staff member, because I do believe staff acknowledgement is very important in supporting patients' live experiences. Next slide, please. Questions maybe later on. Next slide. And the next slide is the care continues here at the Community Management Center. Thank you very
Thank you,
much
everyone.
for letting us present here in this event.
Thank you
Thank
very
you.
much, Justin and Francis, for sharing with us examples of some patient feedback and how you use the real-time data for empowerment and other positive impacts. And also very fascinating and invaluable to see the staff feedback for Care Opinion, which is increasingly being done across health services. As you know, having a platform like this, wanting to implement something that is embedded within a system requires a cultural shift, and having the workforce engaged and providing feedback is very important. So great work with that.